Next, the class of 1995 has selected one of their distinguished classmates, Joeli Hettler, to speak on their behalf. Ms. Hettler?
A pretty cool thing is going to happen today. Hi, Billy. Hi, Billy. I'm going to get a diploma from medical school. Hand in glove with that diploma, however, comes the presumption that I've learned something during the last 4 years. I guess I have learned a new language. I'm often called to answer Thursday night questions from ER-addicted friends and relatives. I've experienced enough memorization and regurgitation learning to know that regardless of circumstances, I can pass any exam. Whether self-critical and sleep-deprived, like in PChem, knowledgeable and confident hematology, or confused and convinced of inevitable failure, that'd be neuropathology. I will predictably get the average score every time. I've appreciated the value of experiential learning, the best example being Dr. Langebartle's method of no guts, no glory, blunt dissection. But the kind of learning that really has shaped my ideas of what kind of doctor I want to be is a little bit more difficult to describe. In many ways, being a medical student is a privileged existence. Never again will I be offered the position of innocuous observer to a great clinician. At first, I resented my role of exam room wallflower, crowded between a sink and a supply closet. I thought it was a degrading suggestion that I was incapable of talking alone with a patient. However, soon I recognized that this would be my only chance during my medical training to observe such a variety of physicians. This then became my time to try on different approaches to patient care, with the thought that I could take the unique qualities I admired from each and integrate them into my own developing style. Although I assuredly learned from every physician with whom I interacted, I have had the privilege of working with some truly inspirational human beings. The gentle, unassuming pediatrician who can enable an angry and defiant 16-year-old drug user to conclude on his own that maybe leaving home right now isn't the best idea. The somewhat eccentric, but nevertheless hero of a surgeon who gracefully accepts nothing less than perfection as he skillfully inspires meticulous thought that ensures each patient is provided with the best possible care. The internist whose quick mind is overshadowed by a compassion that looks beyond the hospital gowns and reveals a ward of artists, philosophers, war heroes, and fathers. These and many others have had a profound impact on the clinician I am becoming. However, there is a group of teachers without whom my becoming a physician would be entirely impossible. It is to these people, who perhaps occasionally experienced minor inconveniences on my behalf, that I owe my deepest gratitude. To the healthy 17-year-old admitted to the hospital for routine knee surgery, thank you for your patience with my required need to do a complete, an obsessive history and physical exam. Although perhaps not directly related to your knee problem, thank you for finding out how old you were when you did take that first step. Thank you for letting me count your teeth. Thank you for letting me test your sense of smell. To the 78-year-old veteran with the typical VA mix and match combination of high blood pressure, heart failure, diabetes, emphysema, and stage cancer. Thank you for letting me learn on you how to place a nose to stomach feeding tube. I'm sorry it came out your mouth the first 2 tries. To every parent of a toddler with a cough and a fever, who let me look in his or her child's ears knowing that the exam would need to be repeated by a real doctor. Thank you for allowing me to try gentle, persuasive techniques before less subtle methods were used to get a good look. To the 9-year-old who lost her hair to chemotherapy, who wanted to play beauty parlor, who braided my hair into knots. You're welcome. To the frightened teenage mother at the homeless shelter, thank you for trusting me with your story. Thank you for letting me hold your baby. To the 53-year-old man with cancer who came to the hospital that Saturday night because he didn't want to die alone. Thank you for letting me sit with you. Thank you for the painful privilege of meeting your wonderful family and helping to explain to them how just an hour before their arrival, you had passed away. To the 28-year-old woman becoming a mother for the first time, thank you for allowing me to follow you through the active stages of labor and delivery. When you turned to the father, looked him squarely in the eye, and said, "You did this to me. Never again."